If you are a young boy or a young male, let's say between 20 to 40, and you have testicular pain specifically on the left side just because it's more common, we are today going to discuss 6 common causes that can lead to this. Testes is one of the most sensitive structures and it can occasionally lead to pain, recurrent refractory pain which is disturbing you for days sometimes. And that pain not always is coming from the testes. It can come from adjacent organs like the epididymis, the groin area, nerves, kidneys, ureters, lot of structures. So that's why knowing the cause and few symptomatic indicators to guide you for what it can be and then where you should approach a urologist or an interventional radiologist or specialist is very vital. Why am I speaking about this? I am Dr. Gaurav Gangwani, a board equivalent certified interventional radiologist, and we are one of the highest global centers of varicocele embolization, particular disease which we'll talk about soon, and a particular technique where we can without surgery, blades or sutures treat that problem. So let's break in to these 6 causes immediately so that you are educated and then you can do something about it. Now, what is varicocele? The blood supply to the testes from the heart is via arteries known as testicular or spermatic arteries. Once that gives off the good gases, the nutrition to the testes, the impure blood full of free radicals and toxins is taken back to the heart via veins. These channels take blood anti-gravity without any major power, so it's not easy. They do have one-way doors or valves within them at few intervals which helps the blood to pump up but does not stagnate down. They close and they are one way. They don't allow the blood to come back to the testes. Mind you, this is impure blood, toxic blood, full of free radicals. But in cases where because of inflammation and ergonomics, these venous valves or channels or walls get damaged, then whenever the patient applies pressure, strains, sits for prolonged periods, stands and sometimes spontaneously, the entire venous blood reverses down, refluxes down, stagnates down and causes a lot of problems. One, it can cause discomfort and pain because the tiny veins are now stretching and causing pain. Second, it can cause heating sensation which is not good for the testes. The testes are kept outside the body in the scrotal sacs by God because He wants it cool so that semen and testosterone production is optimal. And now because of the heat, both these functions can get affected. Many patients come to us with a sensation of feeling that they have a bag of worms underneath the skin. And we explain them that these are swollen veins, not worms and nothing to worry. But yeah, this does require some treatment based on the stage and various things. There are few defense aspirants who are rejected because of varicocele and when we treat them, they can get selected, which is legal in many countries. You can get it treated and continue your dream life of joining the armed forces or police academies where if the varicocele is active, you can't work or apply. So these are common ways why would they present. Of course, many people present with infertility because of the heat and the free radical damage causing low sperm count or motility and then presenting as infertility. They do present to us with that. If it's early stages, which is great, then the treatment is conservative lifestyle management. We'll talk about that someday. If you comment, I'll make a video very soon on it. What are the lifestyle changes for early varicocele patients? But if it's advanced, high-grade varicocele, grade 3 to 5 or 4 to 5 specifically, there is some testicular shrinkage which has ensued. There is semen or testosterone issues. There is refractory pain despite 3 months of lifestyle changes. That now, friends, is concerning. And if that occurs, then we would more often offer an intervention, which can be a surgery by a urologist in the forms of open surgery, microsurgical ligation, laparoscopy, or it can be a angiography-based technique, a embolization, where we go in the testicular veins and just embolize them so that it gets cured. Technique without a blade, scar or suture. Many times urologists are not very happy with varicocele embolization. One, for obvious reasons, but second, because the results are not replicable all over the world. But good volume, high quality centers who have the skill set to do it, we have seen success rate competing with microsurgical ligation and relatively much lower complications or post-op morbidity and a very rapid early recovery. But again, that is for another day. You can comment if you want the video on that. We will make many videos on varicocele. So the first common cause is varicocele, which we dissected in detail. The second common cause is testicular torsion. Sometimes due to various reasons, the testes can torse or rotate on its axis, because of which the spermatic cord carrying it with vessels and a lot of other structures gets twisted and the blood flow to the testes can completely stop. Now, this is vital in an emergency because If it stops beyond a certain time, usually median time 6 hours, but it can be early or late depending on the individual and the amount of twisting and the blood flow stoppage. Even within a few hours, the testes can completely get dead and necrosed because it's not getting any blood supply at all. Now, the third common cause is epididymitis, luckily less emergent. Sometimes it can be accompanied, which means infection and inflammation of the epididymis, the structure next to the testes, can be accompanied by testicular inflammation, also known as orchitis. And the treatment is very decent. You just need to give antibiotics and anti-inflammatory drugs, and usually it settles within a few weeks. The rest of the three causes come from above the testes. The fourth common cause is hernia, inguinal hernia. Basically, our bellies and our scrotal sacs are separated by a layer of fascia, where if there is a defect due to, again, mild pressures, ergonomics, various reasons, muscle weakness, fascia weakness, the abdominal fat and intestines, bowel, looks, various structures can herniate through that defect into the testes, towards the testes, and sometimes right up till the testes. I mean, at least into the scrotal sac. And these inguinal or inguinoscrotal hernias can then lead to a lot of discomfort, pain, usually aggravated by sneezing or coughing. And the only treatment in the world is to push back all of that into the belly and put a mesh there with a laparoscope also, not necessarily open surgery, so that all the herniating contents go back and they do not disturb the testes area. The fifth common cause is a kidney or a ureteric stone. Yes, my friends, if the kidney or the ureter has a stone, a calculus which is pressing upon the nerves, there is some cross connection in the pain nerves which carry signals from the kidneys and ureters and the testes, and the brain gets a signal that it's probably the testicular pain, which is a false referred pain. Once you take care of the stone, identifying that as the cause, the pain goes away. So it's relatively a good pain to have because luckily no problem with the testes. The last one is again an issue with nerves or muscles. So it's more of a musculoskeletal and neural issue where a muscular imbalance can cause nerve irritation, nerve stretching, and that can lead to pain. Usually the genitofemoral nerve is a culprit, but there can be other reasons, other causes. So with this, we have covered all the 6 causes, main causes. Of course, it's an exhaustive list. I'm covering the common causes and the important ones which I wanted to highlight. And if you do have testicular pain and you have been ignoring it for some time, which young males do, there is a component of embarrassment, shyness, some fear, sometimes laziness, or just being ignorant about it, but don't. Many of these conditions may be benign or are benign, but they can take harmful or advanced forms, and then it can lead to irreversible infertility, to very severe orcalgia, testicular shrinkage. So let's not ignore it. Like I said in the beginning, we are ending this video, but if you want us to make more videos on varicocele specifically, which we treat a lot, please comment and we'll be happy to accommodate your request. Stay safe, stay